Hi, I'm Matt Toronto, and thank you so much for joining us today for our virtual lunch education, part of a series we're doing. We love doing these, and we are featuring the newest and latest fillers on the market, the RHA fillers, and these are wonderful. In fact, they're the first FDA-cleared filler for dynamic movement. It moves with your face for a very natural look, and we're so excited we're the first in this area to have the newest, the RHA 1, which is really designed for areas of big movement around the mouth, the nasolabial folds, the marionette lines, to give a very natural look that again moves as you move. So you're going to love this. Noreen Bollinger, one of our great nurses, she's one of the top injectors in the country, is going to be doing a live demonstration with a model that you'll see. And we want your questions. So if you click on the chat box, you can put your question in there. It's totally private. Noreen will answer them at the end. Now make sure you stay to the end because we're going to be giving away $2,400 of dermal fillers, this new RHA line. So two of you are each going to win 2 syringes, again, a value of $2,400. So we hope you enjoy this. There's going to be a lot of great information, and thank you so much for joining this today. So, there's a big difference between a neurotoxin like Botox and Dysport and dermal fillers. Neurotoxins do muscle and movement of the muscle, and fillers do what the name says, they fill. So as we age, we lose volume, and replacing that volume, the cheeks or maybe nasolabial folds, lips, it really can give you a much more youthful appearance. So now we're going to focus on the newest line of fillers, the RHA fillers. And we've had these now for about a year, but there's a brand new one called RHA 1 that we're introducing. We're very excited about. These fillers are unique in that they actually move very well with the face. They're FDA cleared for dynamic wrinkles, meaning wrinkles that move. And so they're different than the normal Juvederm or Restylane, which are also great fillers. One thing we do at AesthetiCare is we carry a full line to make sure we have the right filler for the anatomical zone and for the desired look you're looking for. And our injectors are experts in that. They have a very artistic ability to look at your face and give you an amazing natural look. But today we're going to focus on the RHA line, especially the RHA 1, and I think you're going to just absolutely love the technology behind this new line of fillers. So there's so many fillers on the market, and there's a lot of really good ones, and we carry all of them, but there are some differences. So what makes RHA different than the fillers that have been out for a long time? As I mentioned before, it is really designed for a very natural look and fillers that actually move with you. I don't know if you've ever seen somebody who may had a lot of cheek filler and they smile, and when they smile you can kind of tell they've had filler. The RHA line eliminates that. It's just this very natural, whether you're moving or still. And that's really what makes it unique. The nicest thing about these fillers, they're made all natural, hyaluronic acid. You can't be allergic to them. When I first got in this industry back in the 90s, we had to skin test people for filler because it was derived from cow collagen. You had to wait a month. If you were allergic, you could have it. These new fillers are wonderful. They're all natural. And again, what makes RHA unique is the way it moves with you. So I think you're going to absolutely love these. With the RHA line, there's 4 fillers, and very simple name, 1, 2, 3, and 4. And people ask, well, which filler is going to be best in which area? Well, we want to use a firmer filler in areas that are away from the mouth. For example, the cheeks, okay, or the jawline. And the firmer fillers like the RHA 4 and 3 are going to last longer. But you wouldn't want a firm filler like in the lips or around here. You want something softer. And one thing, our injectors have been very well trained to determine which filler is going to be best for which zone. Now, the most common place for filler would be the tear troughs underneath the eyes here, the cheeks, the nasolabial fold, the marionette line, and the lips. But what's great with these fillers is we can do some great things with hands, with areas in the neck, even the décolleté. So it can be used just about anywhere where you've lost tissue volume or have some wrinkling. And again, our injectors will be able to guide you in what filler is going to be best for what area. Okay, so who's a good candidate for dermal fillers and the RHA fillers? You know, we see people in their early 20s all the way up to 90. So age doesn't have a lot to do with it. But of course, when you're young, you haven't lost as much tissue volume. Most of the young people coming in might want a little bit of an accentuation of the lips. You know, one thing a lot of people are afraid, they see bad lips like Hollywood and the Real Housewives of every county, and they see these big lips. They go, well, I'd love to have a little bit more, but I don't want those big lips. We don't do those giant lips, okay? You can actually do just a little bit and give yourself a very natural look. So in the 20s, we usually see that. Now, as we age, we flatten out in the cheeks and we develop these lines. You see those in the 30s, 40s, and 50s. And so that's very common that people want to just restore a more youthful look. So really, when you look in the mirror and you see an area that has changed as you've aged and you've lost some volume and you want to restore that, that's really the great candidate. And again, our goal is to make this as natural as possible. We have a great saying, the best injectable is the least detectable. We want you to look younger, more youthful, more rested, but still look like you. So with dermal fillers, one nice thing is they last a lot longer than neurotoxins like Botox and Dysport. Botox and Dysport usually last 3 or 4 months. The fillers can last anywhere from 6, sometimes all the way up to 24 months, depending on the zone and the filler used. Now the fillers, the softer fillers in the mouth and around the mouth are not going to last quite as long because they're very soft, while fillers in the cheeks and the jaw lines, areas like that, can last up to 2 years. And we'll educate you thoroughly on that when you come in for a consultation. Now, the nice thing about it is you will see immediate results. In fact, the minute you're done, you're gonna say, hey, I can really tell. Now, you might have 2 or 3 days where you get a little bit of swelling and maybe a little tenderness, but that goes away very quickly. Now, the other thing is we've had people come in and say, oh, I went to this one place and I got an injection, they gave me a bruise, I'm never going back. That is actually not a good indication of a good injector at all. Anytime a needle goes in the skin, you can get a bruise. There's vessels in there that you can't see. A vessel can get nicked and you can get a bruise. So that can happen. I would say about 40% of the people will get a bruise. They go away very quickly. In fact, we have a treatment with BBL that we can diminish the length of a bruise by 50%. So usually a little bit of swelling, chance of a bruise, those are the downtime issues, but right away you're gonna see a great change. And when you look in the mirror right after your injections, you're gonna be really happy. Thank you so much for joining us today. I hope you found it informative. This is stuff we love to do. We love to do this education to our clients and potential clients out there. So what you're about to see, and you're going to love it, Noreen Bollinger, who's a nurse, was voted the best injector in Kansas City by Kansas City Magazine, and she's actually in the top 1% of all injectors in the United States. She is just a wizard. You're going to enjoy it. She's going to be doing a live model. You're going to see some great instantaneous results. Now, a few reminders. Remember, stay to the end, because two of you are going to win each 2 cc's of dermal filler. That's $1,200 and $1,200, a total of $2,400. Another thing, we have a great special. So today is July 25th. As long as you purchase 2 syringes of RHA filler before the end of August, you get a third for free. That is a $600 value. So you're getting 3 for the price of 2. So you just need to purchase it between now and the end of August. And in your appointment, you'll have a consultation, and then all 3 syringes will be used at the one appointment. So make sure you do that. It's going to be wonderful. So you will receive a text message at the end of this event, and it basically is going to ask you, do you want to come in for a consultation? It's going to ask you if you want Liberty or Leewood. Simply answer yes, and we will reach out to you very shortly with a phone call. We'll set you up with a no-charge, free consultation to talk more about dermal fillers and hopefully schedule your appointment. So again, you're going to receive a text message. Just respond yes, Liberty, or yes, Leewood, and we will reach out to you right away.
Hi guys, I'm Noreen, and I'm here with Gina, who is with Body Lab, and she wanted to tell you a little bit about Body Lab today.
Yeah, hi. I am with the Body Lab. We are a Legree fitness studio. We have 2 locations, one in Leewood and one in Prairie Village as well. We teach a method called the Legree Fitness. It is done on the Megaformer, and it is a full body, slow controlled movement. It's high intensity, low impact. It's really fantastic. It combines strength, cardio, balance, flexibility, and we'd love to have you guys check it out. Your first class is free, so we'd love to have you.
Awesome. That's right. So today, let's talk about what we're going to do. So just assessing Gina, she is very fit. She has very little fat on her face. She has great cheekbones. But as you can see, I'm going to turn you towards the camera and chin down. There we go. She gets really hollow in through here and a little bit through her under eyes. Now, she did tell me that she had filler back in January, a little bit under her under eyes. So I'm going to treat that very minimally because you want it to be very soft, very natural. I'm also going to treat the lateral portion. So I can tell that she's had a little bit of filler here in the medial portion, but out here on that lateral portion, she looks hollow there. So I'm going to first start by treating the lateral portion into the medial, and then I'm going to soften some of the contour here. So it's nice to have contour to our face, but as we get older and our fat pads start to go away, we start to reabsorb our fat, or it starts to sag a little bit, and she doesn't really have any. She's just very hollow, that we'll start to see these shadows. So I'm going to take some of the shadowing out around her mouth, and then I'm going to treat some of these little fine lines here around her mouth. We're going to be using Redensity, which is the newest filler, and I absolutely love it. It is a filler that's awesome for fine lines, wrinkles, something that you don't want too much swell or too much volume, taking out etched in lines around the mouth here and up around the eyes. We don't want a lot of swell around the eyes because we want it to be very, very natural. And so we'll use the Redensity, which is the newest filler. We're going to be doing that around her eyes and around her mouth. And then I'm going to be using RHA 3 right through here just to soften that cheekbone. And so instead of kind of having a cliff drop off right at the cheekbone, I'm just going to have this nice smooth transition. It'll make her look more youthful. I'm going to be using a cannula in most areas, a needle in some areas. So a cannula is a needleless needle that is going to help her not bruise. Not that you can't bruise, but it's going to help minimize bruising, and it's also going to be a lot less painful with the cannula. So I'm going to get her cleaned off. She's been numbing, but I'll get her cleaned off, and then we'll get started.
Love it. While you work on cleaning her off, I'm going to read a couple questions that have come through already. So somebody asked if this can be used in the lips.
It can. So Redensity is beautiful for the vermilion border and for the perioral lines. And so that is the newest filler. I use RHA 2 and 3 in the lips all the time. It's beautiful there because it's going to give you more of a plumping effect, more of an augmentation. So if it's somebody that just wants the little lip lines, perioral lines, or the crepiness in their lip treated, then this would be a beautiful product for that.
Love. Do you treat and consult within the same day?
Yes, we can do that. So when you call to make your appointment, make a consultation appointment and let them know that you would like to treat on the same day as well. And as long as I think you're a candidate, we can definitely do that. Now, if it's something where I don't necessarily think you need it in an area, if you already have volume in your lips and you want more, I may say, let's wait a little bit. But typically we can do it in the same day, or you can consult and then come back a different day if you like.
Awesome. If you have a special event, how far in advance should they make their appointment?
So at least 2 weeks, because you can have bruising, you can have swelling. So it takes about 2 weeks for everything to settle. And, the biggest thing is if you have a wedding, don't come in 3 days before your wedding and tell me don't bruise you, because that's exactly what will happen. I will bruise you. But that's a great question. And the other things to help with bruising, no fish oil. Fish oil is a big one. Aspirin, ibuprofen, about a week before if you can go without. Now, if it's something prescribed by the doctor and you're on a blood thinner, you simply stay on that, just knowing that you probably will bruise. But if you can stop that, you're going to minimize your risk for bruising.
Awesome.
Another thing I want to say while I'm cleaning our makeup off, when you come to your appointment, if you're ever scheduled for filler, come with no makeup. This makes my job so much easier. Getting other people's makeup off sometimes is hard.
Good to know. Protect.
I know.
What is the composition of this filler and how long does it last?
So all fillers are hyaluronic acid. We make hyaluronic acid in our body. It's actually a sugar compound. It's polysaccharide, and they're naturally entangled. So those hyaluronic acid molecules are naturally entangled in our body. Now, when we look at filler, it's 99% what our own hyaluronic acid is. The really cool thing about this product, it's the least modified. So we have these hyaluronic acid molecules, and what happens when they make the gel, they heat them up, and it breaks down some of the chemical bonds that hold the molecules together. And so then we use a chemical called BDDE to link them back together. This product, the way they actually modify it, they have the less chemical BDD in it of any product. So RHA 2 only has 2% of modification. So it is going to be the most like a normal HA molecule with the hyaluronic acid molecules linked together. So this is as close to our own hyaluronic acid that we will get, which is pretty awesome.
Very cool. And we're one of the first to get Redensity, aren't we?
Yes, we are the first in town to get Redensity. Now we are also waiting for a new neurotoxin from this same company. And I got word that we are supposed to know by September 8th if the new neurotoxin, the new Botox, if you will, if it is going to be out. So September 8th is going to be an exciting day to hear if that will get launched. It's going to be a new neurotoxin that will have a 6-month indication instead of a 3, which I'm sure you all will be really excited about that.
Mark calendars for that. That's exciting.
So right now I'm just prepping her skin. So I've gotten all of her makeup off now. And now I'm putting chlorhexidine or HiPAClins onto her skin to make sure there's no bacteria. Because remember, when you're getting filler, it's a gel implant into the skin. So it's really important to make sure there's no makeup, there's no bacteria that sits on the surface. Super, super important. I clean until I see no more makeup. And if there's makeup, I keep cleaning. So this is a really important thing. This is an implant into the skin. So make sure when you're going to a provider, make sure you know who they are. Make sure you know how many people they've treated. Make sure you know their credentials. It's just like you wouldn't go to just a primary care doctor to get a knee replacement, right? You go to a specialist that you had researched. So super important. As filler and Botox and everything becomes more common, everybody thinks they can do it. And we see a lot of the problems people have had that come to us to fix it. So we don't ever want you to have an infection. We don't ever want you to have an adverse event. So it's really important who you choose to give you filler, administer it, Botox, and that type of thing. Super important.
100%. How long does the RHA filler last compared to other dermal fillers?
So clinical studies, FDA approval was for 15 months. Most of our other fillers are FDA approved for 1 year. Juvederm Voluma has an FDA indication up to 2 years, but all the rest of them have up to a year. So this one is 15 months, and I have found in my clinical practice that it does, people that metabolize filler really fast, when I changed to RHA, it is lasting much longer. So I am seeing that longevity that's in the studies now that we've had it about 2 years. Europe, Dubai, those different areas, they've had this filler for about 7 years, and they do report, same thing, colleagues over there, that it is lasting longer than our traditional hyaluronic acid fillers. All right, my dear, no pinch. I'm just now going to treat her lateral portion of her under eye. Small little amounts. And in this area, I find that you just can't really use a cannula because you have a ligament that sits right there and it will just want to push it the other way. The other thing that's beautiful about this product, if you've ever heard of the term Tyndall is when filler naturally has, even though it's clear in the syringe, so it's clear, it has either a blue hue once it's into the skin or a greener hue. Not like truly blue or truly green, but sometimes where she's had some filler before, I can see that she probably had Restylane just with the little hue of color in here. So this product does not have any Tyndall effect, which is why I'm super excited about it. What you don't want to do is put filler in and see a little darkening into the area. So this one, everything I've read about it is you don't have to worry about Tyndall, which is beautiful, because that's the one thing we always worry about with filler in areas with really thin skin, which is around the under eye.
Another question, when you're done with that, would this type of filler be safe for someone with an autoimmune issue?
So great question. So anytime you're putting an implant into the skin, especially with an autoimmune, you want to make sure that your body is not going to react to it. And so this would be a product I would use with autoimmune, knowing that you can have, anybody with autoimmune, their body can react to anything. So what I would avoid with autoimmune, especially if you're not controlled, would be Sculptra, would be Radius, because those products can't be reversed. So somebody with an autoimmune, if they had a problem, I could come in, use Hylenex, and just dissolve the filler that was placed. So this is a safer filler because it's the least modified compared to the rest of the fillers. This only has a 2% modification. All the other fillers have anywhere from 3 to 9% of modification, basically keeping those hyaluronic acid molecules bound together. So that's a great question. Now with autoimmune, don't ever come in for a filler treatment, any time of implant into the skin if you're flared. So say you have lupus and you've been doing great, you haven't had a flare up in a while, I would say, come in, let's talk about it. If you have just had a recent flare, you do not want to get filler right after because your body is going to probably react. So autoimmune, just make sure you're going somewhere where they really talk about, the potential risks with an autoimmune disorder.
Perfect. Is there anything to reverse filler if there is too much or if there were to be a reaction?
Absolutely. So we have Hylenex, which is an enzyme that breaks down filler. And so we make hyaluronic acid in our body, and this enzyme is the antidote. So if you have had filler and you don't like the result, I can always go in and reverse it. So that's why, especially with autoimmune, you want a hyaluronic acid molecule, not some of the other types of fillers or biostimulators that you can't.
Perfect.
Okay. We have the best model with a great Great comfort level. She's doing great. She has a great pain control because it's pinchy. This isn't the most.
How is it feeling, Gina?
Honestly, I was kind of falling asleep.
Okay.
I
I
wish
get
she was
up
like
very
every other
early and I'm
day.
like, this is really
Kind of nice. Okay,
maybe
good to
wrong
hear.
with it.
Yeah. What is the cost comparison of the RHA line versus the other dermal fillers you've mentioned?
So very similar. So RHA 2 and 3 and this new Redensity are $5.99 a syringe. RHA 4 is $7.29 a syringe. So just in line with our other fillers. So RHA 4 is designed for cheek area, mandible, chin type of areas, just like Voluma or Restylane Lift. And RHA 2 and 3 would be similar to a Juvederm or a Restylane Refine Define. So we try to keep all those prices consistent and really allow our providers to pick what is best for you, because what's best for her and what's best for you may be different. So the price isn't really impacting what I'm choosing for each client.
Somebody asked, and I'm sure this would vary, but they said, how many syringes for the whole face?
That is a loaded question. So the best thing to do is come in and let me take pictures and assess your face. I am a provider that I like to treat to completion, because if I just come in and give you cheeks, but you have all these lines and wrinkles and hollowing around your mouth, you're probably not going to be very happy. So typically for a full face rejuvenation, anywhere from 4 to 6 syringes. But if you're somebody that, say, is 70 years old and never had any filler, you might need more. If you're somebody that's 30 and barely have any lines or wrinkles, you may need 1 or 2. So it's just a range, and everybody's treatment plan is completely different.
Somebody did ask if you have to use all 3 syringes by the end of August, and yes, you do. That's part of the...
Now, I think they have to purchase, correct?
Correct.
So you can purchase, but say you're going on a trip and you won't be back and wanted to use it in September. Can we do that?
No, we're doing all 3 in the same appointment.
All 3 at the same point. Do they have to have their appointment by the end of August?
No.
Okay,
So
that's yes.
even if they pre-purchased for the 3 and then they wanted to come in September
Yep.
and get them, they can.
Yeah, so just have to purchase, and then basically what we do is we put it on your account, and then you make a time that it's best for you and your schedule. So if you're on vacation and you can't come in before August, then you can get treated after, and it'll just sit in your account. So now I'm using a cannula. Even this looks scary because it's long. It's not a needle, and so it should feel pretty painless. She'll just feel a little pinch here and there because it's a blunt tip. So it's not like I'm sticking a needle that's that long in. It is a needleless needle. Smile for me. Beautiful. Smidge on this side.
Someone is curious what would happen if she were to gain or lose weight.
Oh, great question. It really wouldn't have any impact. And this is the reason why I love fillers that last, anywhere from 1 to 2 years. Because if I had used a product called Bellafill, say that lasts 5 to sometimes 10 years, and we still age or fat pads descend, we're having changes all the time. And she's not going to look the same right now as she would 5 years from now. So it's not as natural. With a hyaluronic acid filler, it's going to be very natural. Even if she gained a little bit of weight or lost weight, it's not going to look puffier in that area because I'm only treating to where she needs it to take out some hollows and contours. So it wouldn't make her puffier in that area if she gained weight. But that's a great question. 1, 2, 3. So now I'm just filling the medial part, again with that cannula. She's going to feel just a little bit of pressure here. So the under eye area is the most delicate area to have treated. I see the most complications. And I tell people when I'm training, don't touch anybody's under eyes until you've been injecting for at least 2 years. It is the thinnest skin, so which means that you'll have the highest risk for seeing the product. And you have a muscle and ligament right in that area that every time you smile, there's animation. So make sure when you schedule under eye filler, it's somebody that really knows what they're doing, because this is the highest incident for issues in this area. Smile for me. Beautiful.
Someone is curious if this can be used for the pre-jowl sulcus.
Yep. I would actually use RHA 3 or 4 for that area. This would be too thin of a product. But RHA 3 or 4 is beautiful in that area.
What is the pre-jowl sulcus?
So the pre-jowl sulcus, sit forward just a bit, like bring your head forward. So she really doesn't have it, bring it down a little bit. So what happens is we have a gel fat pad here that herniates or gets hypertrophic as we age. So it gets fuller. And then we get this little sulcus right here. So the area right before the chin, the gel fat pad will come down, and then we get this little hollow here. So a lot of times when I'm trying to treat that, I will treat this posterior region of the mandible. I'll bring all of this back first, and then I'll put a little bit in that pre-gel sulcus. So you want to think of treating when we start to sag and everything starts to fall forward. Think of treating back here versus everything right in front. Because if we can lift it back, it's going to look much more natural than making it look heavy in this area. All right, now I'm back. Smile for me one more time. That's perfect. One last spot here. Of course, I said one last spot and I gave her a bruise.
Oh, that's how it goes.
That is right.
Someone is now curious if it could be
Focus
used
right.
in the chin areas
Right
for
there.
any wrinkling or shallow areas
Yes.
happening right in the chin.
Yes, that is this product is beautiful for that area because it's just taking out those etched in lines. That would be an amazing product for this area. And she's got some right here that I'm going to fill. And pucker for me, dear, and relax. Another thing too that I'm going to do, you sleep on your side, don't you?
Mm-hmm.
So I can tell she sleeps on her side. Sit forward just 1 second. So the reason why I can tell she sleeps on her side, you can see exactly what happens where she's starting to get this hollowing. So I'm going to put some of that filler there as well. But lean back. And I'm going to see if I've got any numbing. That's a really spicy area.
I think it's right behind that mirror.
Oh, yeah. Oh, right here. So hold tight. I'm going to put some numbing on there so she is still my friend when we're done.
And how are you doing? Great?
Good.
Good?
Good. While you're numbing, someone said, hello, I want my lips done to make them fuller. I've never done injections before and I'm terrified of them hitting a blood vessel and having complications. I also read it can cause stroke, etc. How common is this? And do you know if you are going to hit a vessel?
So anytime you put a needle under the skin, there's always a risk of hitting a blood vessel. And basically it's the technique. So extremely rare, in all the years I've done this, I don't know anybody that's ever had a stroke, not one person. Go ahead and take that down. The big risk is for an occlusion. So if I was in a blood vessel and I put a big blob of this gel hyaluronic acid filler, could I cause necrosis and block off blood to that vessel and any surrounding tissue? Absolutely. As long as you have a provider that knows what they're doing, as long as the needle's moving, we're doing different safety protocols. So, you know, when I'm in high risk areas, I'm aspirating, doing those things. It's not something to worry about per se. It's always a risk. Is it common? Absolutely not. It is very, very, very uncommon. So the things you need to know as a provider or as a patient is what to do if you got home and you're like, oh my gosh, I'm having extreme pain. It looks like it's blanched. You're kind of white in the area. You would call your provider. You would come in and we would just dissolve the product. So it's a great question. Is it common? No. As I don't know what the incidence of stroke is, but it's very, very, very low. And That's the biggest thing about knowing your provider, knowing that they're a provider that's licensed. There's people here in the Kansas City area that are estheticians and injecting filler into people's face, which is very, very scary because they haven't had any science, any anatomy, any of that training that we do as nurses and physicians and that type of thing. And so really just making sure that your provider's credentialed is the biggest thing. Don't ever be afraid to ask questions. How long they've been doing it? How many patients have they seen? So if you have a provider that's injected 2 sets of lips, you probably want to maybe think about, you know, what their expertise level is and their experience.
Someone is curious if it's effective for defining that jawline.
Absolutely. And as long as you're a candidate. So, you know, the jawline has been a recent kind of buzz. You're seeing all these pictures on the internet with these really chiseled jawlines, but not everybody is a candidate for it. The reason why I say that is you've got to make sure you've got the established cheeks, so everything is nice and lifted before I start putting filler here. So we want our face to be more like a V. So if we have some sagging skin and flat cheeks and we go putting filler here, you're gonna look really heavy. You're actually gonna look much older and not as youthful. So as long as you have nice, beautiful cheeks and fat pads there, everything's lifted, I would put some filler here. It really is patient dependent. I tell more people no on jawline filler and end up filling their cheeks or another area than I do actually jawline filler. Because if you've got fullness in this area already and then I put volume there, you're not gonna be really happy. So yes, I do it, but not on everyone.
Good question.
Now I'm going to go ahead and take out some of this shadowing I see right under her cheekbone and just kind of soften her appearance. Just changing my gloves.
And she'll have great before and after photos also that we can share. I'm kind of talking to your audience here
Perfect.
on Body Lab.
All right, let me turn this way. Just a little pinch right here. So I'm just making a little pinch there. And then I'm going to use that cannula, so hopefully we don't have bruising.
Awesome.
Do you want to explain how we're doing the giveaway?
Oh, sure. So for those of you still on, at the end here, we check out everybody that attended and stayed through the end, and we randomly pick 2 winners. And those 2 people will each win 2 free syringes of RHA filler, any within the line. So 1, 2, 3, 4. You would just come in for a complimentary consultation, and we'd determine what fillers are right for you based on your area of concern. So really good deal. That's $2,400 in total that we're giving away for free. So be sure to stick around, and then we'll be calling those winners afterward.
Woo-hoo.
So exciting opportunity there. We do have someone, we kind of addressed this. She asked what happens to the look of filler if you are currently on a weight loss plan and your face continues to thin out.
You'll be totally fine because we're doing it in areas where it's trying to give you the most lifted achievement that you're looking for your face anyway. So it's not like you're going to see filler because it integrates with the tissue. So it's going to be very natural. Even if you lose weight, you're not going to see a blob of product in an area as long as it's done right.
Perfect. Someone said you may have already answered this, but does this filler help build collagen?
You know, anytime you put a needle under the skin, you're going to get a little bit of collagen, neocollagenesis. This is not Sculptra though. So Sculptra is a biostimulator that builds collagen. So this is different than Sculptra. And in my opinion, everybody needs Sculptra because everybody needs more collagen. After the age of 18, we lose 1% of collagen a year. So this, I think of filler as complementing the collagen that we need from Sculptra. And she would be an absolutely amazing candidate for Sculptra because she's got a very thin face. So Sculptra would be great for her. Smile for me. Perfect.
This person wants to know why you would pick an RHA filler over Allergan or Galderma. She's just curious why, if you went in for a consult and just said, what would you use, why you would maybe lean towards RHA.
That's a great question. It really depends on the patient. I love RHA because it's very, very natural looking. And the degree of modification is very, very minimal. And redensity is now going to be my go-to for fine lines and wrinkles because I can put it as close to the skin as I want to, and I'm not worrying about seeing the filler. I'm not worried about tyndall or it's showing the color showing. So RHA redensity is going to be definitely be my go-to for the fine lines and wrinkles around the mouth and under eye.
Awesome. Someone else is curious if all of the injectors at AesthetiCare can inject this product or if it's only certain injectors.
Only the nice ones. No, all the injectors can inject RHA. They've all gotten their hands on with it. We all get to play with the products when we get something new. So each injector has some to kind of play with and work with to kind of get the feel of it and really decide what they think of it. That's the biggest thing. We're all different. We all see different things. And so while, RHA may be one of my favorites, it's maybe not necessarily be everybody's. So it's one of those, talk to your provider and see what they think. And that's also the skin type you have, how thin your skin is, and the area of concern that you're wanting filled. But yes, they are all amazing. So we have seven injectors in Leawood and 2 in Liberty, and they're all master injectors. They've all been doing this a long time. They're all nurses or NPs. They have that background in anatomy, and so they're all very well versed with the product and what's going on with your skin.
Someone asked, can you do filler and collagen injections at the same time?
I would not do them at the same time, although I love Sculptra. I would actually get Sculptra getting on board first, get that collagen going, and then contouring with filler. I don't love them both in the same day because Sculptra uses its tiny little particles of polylactic acid, and we dissolve them in bacteriostatic water. So you're going to see a little bit more of swell. You'll see a little bit of that water on board initially. And so I would wait and do your filler a couple months after your Sculptra. Great question. Feel pretty numb around your mouth?
And people are asking how you're feeling.
Mm-hmm.
Good.
So when you saw her kind of jump, so I have a cannula, which is a needleless needle. So it's not slicing through vessels and such underneath the skin. It kind of bumps into different things. And so when you saw her jump, I was probably right up near a ligament or a muscle that kind of, she just felt a little zinger, wouldn't you say?
Yeah, immediately went away.
Yeah. So it's just like, oh, I felt that. But like I said, I love to use cannula where I can, even though it looks like it hurt, it really doesn't unless you are right up against something and you don't swell as much, you don't bruise as much.
So this person says, I'm new to fillers. Is this product great for beginners or for more people that have used fillers in the past?
This product is great for anyone. Just depending on what you're wanting filled. So it's great. All the fillers are great. I actually train for all 3 companies. They're great, but you just have to decide what filler is best for each person. This redensity I love because I can be so superficial and I can get those little etched in lines out without bulking somebody. And so this is probably going to be my go-to from now on for under eyes, fine lines and wrinkles. But just like I love RHA 2 and 3 for lips, areas around the mouth, I love RHA 4 for cheeks. So yeah, it's great for anyone.
Can you use it with that cauliflowery chin?
For the dimpling in the chin. So she's asking about the contour of her chin. So you can kind of see, turn towards the camera over here. She's kind of dimply here in her chin. You can use it for that, but I would first start with a Botox or a Dysport in that area because that muscle, when that muscle moves, that's why you start to see the dimpling in the chin. So I would start with a little bit of Botox or Dysport, and then I may layer in some filler as well. So now I'm going to do some areas around the mouth. And this top lip is very pinchy. So it is the most tender area on the face. And I'm going to use a needle. But I'm going to get where she's got a little bit of a sleep line. I'm going to take that hollow and depression out because this line is going to keep getting worse as she ages. And she's going to see a deep line really start there. So I'm going to try to give her a little bit of structure, okay? All right.
This is her friend over here tapping on her leg, so I'm
you can do
distracting
the
her.
area. If anybody's had filler that's watching, you know that this is the spiciest area.
Totally.
So we're giving her the old tap tap. She's singing.
Now, this would be the same. This would be the same feel with any type of filler. Just this area has tons of nerve endings. That's why people kiss, because that, you know, you feel it more than any other area. So it is spicy, whether it's this filler or a different filler. All right, pucker for me here. So I'm going to go ahead and relax. I'm going to get a couple of these deeper lines here when she puckers that you can see.
Awesome. Someone else is curious about filling any forehead lines that they have.
Yes, you can definitely do that. And I would use Redensity. First, I would start with Botox or Dysport. And then I would go, if you still see them or you've been using them, using Botox in that area, and you still notice that you see those, you can definitely use filler in that area.
Perfect. What if I've just had filler and won't need it for another year? Is it possible to purchase this, or should I wait for other specials?
Now, the question would be, did you get treated to completion? Or is there another area that you would like to soften? If there's another area, then you could do it. If it's a full year, I might wait. If you don't think you'll need filler for a full year, then I might wait for that other special. All right, little pinch here. Now I'm going to put a little bit right in her vermilion border. Pucker now. So now it took those little lines right above that lip away.
That's amazing.
Wow.
Yeah.
Pretty. So you don't sleep on this side nearly as much.
Half, maybe.
Yeah.
Look, I had to do the whole pull up.
Yeah, right. Vision.
She's not as deep on this side, which is great.
Kind of branching off the forehead line. Someone is curious if this would be good for those 11s, like kind of right in between the brows.
Yes, first I would do Botox or Dysport there, and then this would be your next option. Now, anytime you're doing filler in the forehead or lines between the eyes or nose, those are the riskiest places of the face to get filler. While I've done them over the last 10 years a lot, if you're worried about an occlusion, anything like that, this is going to be your highest risk area. And so I always talk to people about that. If you're coming in and getting filler in your forehead between the brows and your nose, highest incident for issues, I will give you my phone number. If you ever have an issue, you call me right away, because these vessels link up to the vessels of your eye. And so we just want to make sure there's never any filler in the eye, or in the vessels that feed the eye. Which is why when I do this area, I typically use a cannula, which is that needleless needle. So I'm not going to cannulate a vessel. Could it happen? Yes. Is it extremely rare? Absolutely. But having that, I just had a client last week that had been over in Korea and getting Botox, and they told her she needed filler in her nose and did it. And I said, did they tell you about the risks? And she said, no, everybody in Korea gets it. Like, it's no big deal. The highest incident for necrosis is this area, and it's Korea, China, those different areas where they do it a lot. We don't really see it here. Could it happen? Absolutely. It could happen anywhere on the face. But I just let everybody know this is a riskier area. I still treat it. I just let them know if you feel like there's any issue at all, you call me right away, and then I would have you come in and we would take the filler out.
Perfect. Someone said that they just had fillers about a month ago. Curious how that would affect things.
As long as they still need some filler, it wouldn't affect anything at all. So you could get more filler. It just depends if you need it. Pucker for me, dear. And relax. And if you didn't need it, we would tell you you don't need it. That's the biggest thing. So if you go somewhere and they aren't honest, like if you don't need filler, if you don't need volume in an area, you should be told that.
Right.
You want it to be very, very natural.
Speaking of maybe not needing fillers, what would be the best kind of filler to use on someone under the age of 18?
Well, first of all, it wouldn't matter the type of filler, but you would have to have a parent sign for you. And, you can't come in and get filler under the age of 18. And this product is FDA approved in 22 and older. Now I'm assuming the 18-year-old younger than 18 wants their lips done.
Probably.
Yeah, I mean, as long as you have a parent sign, I would just be cautious starting things too soon. In the East and West Coast, they do it all the time. Here in the Midwest, or younger people aren't doing it as much.
We did have someone chime in and said, I don't have a question, but just as someone who's previously had Juvederm and Kiss in their lips, I did RHA last time I got injected and absolutely loved it. So natural feeling, and Noreen is amazing.
Aww. You know what I will say is the RHA, it's almost like you forget it's there because it's so natural. It's so soft feeling. So I will agree with that. It is just very soft. It's almost like you kind of forget you have it there, which is great for lips. You don't want to feel like you feel the filler. So it is great.
Yeah. And how's our model feeling? Speaking of feeling. Okay.
So, and I'm not giving her lips. She already had beautiful lips. I'm just softening the transition between the lip and the perioral area, or the skin up top. She had some of those little fine lines feeding into the lip. So I'm just trying to soften it. Now she will have a little bit of swelling there tomorrow, which is completely normal. But it'll be beautiful. I do notice that this does not swell as much as some of the other products, the Redensity, which is great because anybody knows if you get your lips done, you're always going to swell the next day. I always say, talk yourself off the ledge.
Good to know. This person said, how about the tiny lines that are left around the lower mouth after getting filler in the cheeks?
You're probably talking about the marionette lines. So these lines down here, you get your cheeks done, and then you're seeing some of this down here. RHA 2, RHA 3 is great for that area. And I'm actually going to do a little bit of filler in there as well on her to keep the corners of her mouth up.
Awesome. And then someone is curious, I know we're still working on our live demo, but when all said and done, how many syringes will we have used on lovely Gina?
I probably 3. So I've used 2. She didn't need much around her eye. And then in that submalar area, kind of down below her cheekbone, I did a half on each side. And now I'm just finishing up some of these little tiny lines around her mouth, just giving her a little bit of structure there.
Awesome.
And then what's her post-care?
So post-care for her will be no makeup today, no lotions, anything on her face, even not putting her cell phone up against her face today. We want all these little tiny pokes to be completely closed just for infection. We don't ever want her to get an infection.
Right.
She might have a little bit of tenderness, which is completely normal. Tomorrow she can go back to her normal wearing makeup, anything like that. She can also, where I did a little bit in the border of her lips, she can use ice packs today to help with that as well. So that'll help any swelling.
Awesome. Someone just asked about a lip flip versus lip filler.
So yes, doing 2 totally different things. So lip filler is actually either augmenting to give you more volume in the lip or to help with the fine lines, crepiness, loss of integrity of the lip, loss of elastin and collagen. A lip flip is relaxing the muscles around the mouth. The muscle around the mouth is a circular muscle. So every time you pucker, drink through a straw, eat from a spoon, you engage those muscles, and that's where you start to get the perioral lines, the smoker's lines, what a lot of people call them. And so a lip flip is giving a little bit of a version or popping your lip out just a smidge. and helping you so you're not puckering in as much, making those lines worse. So I do the lip flip. You know, it's funny that they call it a lip flip. For the longest time, it was just Botox on your lip. We've done it for years and years. Social media started it being a lip flip. So I typically do it for people that have a lot of perioral lines that almost overactivate that muscle when they pronounce words or they drink out of a straw, that this muscle gets so strong that I want to make them not use it as much, because that's why those lines come. And so one's not better than the other. It's just kind of what your goals are. Now with Gina, I wanted to give her a little bit of structure around. So those lines, she had a couple lines on each side feeding into the lip. And I wanted to give her structure so when she wears lipstick and stuff, it doesn't bleed. Do you ever have your lipstick bleed? Mm-hmm. So she had one on each side here and here that were going straight into her lip. So if I don't give her a little bit of a border and structure there, it's just going to bleed right into the lip.
Someone is curious if RHA has a loyalty program similar to how Allie does.
And they do not, unfortunately. They don't. They want to make it easy, so you're not worried, about discounts with it and that type of thing. So they don't, and I don't think they plan to. But RHA's priced really nicely, and so it's almost like you don't need a discount, and you're getting more longevity. And so their thinking is, we're already pricing it really great. You're getting good longevity more than you do with other fillers, so they don't feel necessarily like they need one.
Awesome. Another good question. I'm having some wrinkles and such on the top of my nose. I can't seem to find anyone for a fix for that. Would filler work?
Botox first. So wrinkles that are here, it's because the muscle over the nose, called the nasalis, starts to contract. Especially if you had Botox between your brows, you'll start to scrunch. And it's just part of, you're not using one muscle, you compensate and use another muscle. So I would start with Botox or Dysport first. And then if not, that's always a place you could do a little bit of filler. Typically Botox or Dysport makes that go away though.
When I've had lip filler above and in my lips, they used a mouth block by a needle. Do you ever use that?
Sometimes. I try not to, for the simple reason that I want to see the person animate. So if I'm doing filler on you and you're blocked, like you went to the dentist, and I ask you to smile so you're nice and even when you smile, I can't tell if you're smiling. I can't tell if you're even. Always one side gets blocked more than the other, it seems like, and then you look like you had a stroke. So I do it on some people if they have a low threshold for pain, but I prefer not to it, because if you've noticed, I keep telling her smile, do different things, because I want to see what the area, the tissue is doing with animation. And that's a nice thing about RHA is they want to be very adaptable and dynamic. And so that all of their studies they do with animation, with movement. So the filler integrates beautifully so you don't look like you've had filler. I'm sure you've seen people that walk around and you think, oh my gosh, their cheeks, they look like a cat, and it looks just like they have lumps of product there. This product is very different than that because it really integrates with the tissue and it's really dynamic. And so that's the beauty of this product. It's almost like filler that doesn't look like you've had filler, which that should be with every product. And here at AesthetiCare, that is our goal. You should never look like you've had filler. But that's why I really love this product, because it integrates so beautifully and it looks like they're just polished and that they haven't had filler.
Most injectables, least detectable.
That's right. I'm going to do a little in the border of your bottom lip. Is that okay?
Mm-hmm.
It'll be a little pinchy.
Okay.
Will help distract.
Yeah.
All right. Relax your spine.
Now we're tapping again. We're tapping. I know. Our gorgeous model is only going to be a little bit more gorgeous after this.
I know. Rough life.
Da, da, da.
Someone is curious if there are any fillers or even treatments maybe that are better that could help with prior acne, scarring, and pitting.
Absolutely. One of our best treatments for acne scarring is microneedling with radiofrequency. So we have two devices here at AesthetiCare. We have one called Intracell and we have one called Genius. And they provide a protected injury to the skin, both through physical needle pokes into the skin and through a radio frequency heat. And so that would be the first thing that I would do, try to break up some of that scarring. And then we can put filler in where those little acne scars are to fill out the divots. But we want to break the scars up first, and then we would go to doing a little filler. Another thing is some of our lasers, halo, micro laser peel, profractional, just depending on how deep they are, what type of scarring there is. And that would let us decide what would be best for you.
Awesome. Since you've been doing under eye filler today, someone was curious if you can do Botox in that area.
Yeah, definitely. Yeah, and I love a little Botox right under the eye. It helps with those little crepey lines that we get when we smile over and over. And so Botox is great there.
Someone said, what would you suggest is the best filler to use on the face to lift the cheeks and add more definition to the face because I have a baby face?
So not necessarily what product, but the lateral projection. That's the biggest thing. Is when you have a full, which is beautiful when you have very full cheeks because it's a sign of youthfulness. But when you're fuller here, have a really round face, giving you a lateral projection here will actually slim the face and make it look more like a V. So definitely give you some lift out wide would be your go-to for that. And I would have to look at you to see kind of what filler, RHA 4 would be beautiful there. Restylane lift could be just depending on how much lift you need.
Awesome. Someone's curious if you lose the ability to animate or smile or show an expression if you were to go the lip flip route and you're pausing those muscles.
So I tell people when they come in, lip flips feel weird. 9 out of 10 people love it. 1 out of 10 people hate it. I'm one of those 1 out of 10 people. You can't pucker in as hard. And so if you're one of those people that enunciates and really pulls in when they enunciate, so saying P's, different things where you pull those muscles in, you might not like it. It'll be good for you because it'll kind of train your muscles to not do that. But I feel like almost like my lips feel a little numb. Like I said, 1 out of 10 people won't prefer it and be like, I didn't like the way it felt. Most people do. So I always say try it once with a small amount, and then we can go back and do it again if you love it. If you don't love it, then we don't.
Okay, well, I feel like we've reached our hour mark and all the questions here are answered. So we're going to be logging off here and you'll be getting a text message to your phone. So just respond yes, Leawood, or yes in Liberty, the location, if you're interested in taking part of our buy 2 get 1 free with RHA. Thank you so much, Doreen.
Thanks for watching. I hope you guys learned something. And we will post before and afters of Miss Gina.
All right,
Awesome.
thank you.
Thanks, everybody.
Bye-bye.
Bye-bye.